Hi, I'm Helen Bauer, and this is the Heart of Hospice podcast. The Heart of Hospice podcast is your source for compassionate and informative discussions about hospice and end-of-life care. I'm a certified hospice and palliative care nurse with over 15 years of experience. Whether you're a caregiver, someone with a serious illness, or you simply need to know more about hospice care, this podcast is for you. Join me as we explore all the aspects of hospice, from the details of caregiving to the emotional and spiritual dimensions of end-of-life journeys. For more resources and to connect with me, visit theheartofhospice.com and find us on Facebook, Instagram, and LinkedIn. Keep listening for today's episode.
This is the Whole Care Network. Helping you tell your story one podcast at a time. Content presented in the following podcast is for information purposes only. Views and opinions expressed in this podcast are solely those of the host and guest and may not represent the views and opinions of the Whole Care Network. Always consult with your physician for any medical advice, and always consult with your attorney for any legal advice. And thank you for listening to the Whole Care Network.
This episode is being sponsored by bkbooks.com. BK Books helps families and care teams understand what to expect at the end of life. Created by hospice nurse Barbara Carnes, these trusted booklets and videos explain the physical and emotional changes of dying in a clear, straightforward way. Whether you are caring for someone you love or supporting others in your work, BK Books provides reliable guidance that reduces uncertainty and helps people feel more prepared. Explore these end-of-life resources at bkbooks.com. This episode is sponsored by Hospice Navigation Services. When you need information about hospice, Hospice Navigation Services is here to help. An expert navigator will answer your questions about end-of-life care and give you the tools to feel confident in your decisions. A hospice navigation session is a great way to troubleshoot your current hospice care. It's your journey. We can be your guide. Visit hospicenavigation.com to schedule your hospice navigation session today.
Hospice nurse Allyson shared her dying experience with filmmakers Barry Koch and Jason Zamer. They're continuing to tell her story in today's interview. Barry Koch is the co-founder of TG Beyond. It's a company focused on creating media content that helps people navigate physical, emotional, and unavoidable administrative aspects of dying. Most recently, Barry's the co-producer of the award-winning documentary A Butterfly Has Been Released. It's a film that follows hospice nurse Allyson during her final 39 days with life-limiting brain cancer. Barry holds a certificate of thanatology from the Association for Death Education and Counseling, and he's a member of the Green Burial Council Speaker Bureau. He's also a longtime volunteer for a large not-for-profit home health and hospice provider. My second guest is Jason Zamer. He is also the co-founder of TG Beyond. With 20 years of experience at the intersection of end-of-life care, media, and storytelling, Jason is an award-winning documentary director who helps people start life's most difficult and important conversations with the ones they love most. At TG Beyond, he pioneered the terms deducation and dedutainment, terms that define creating approachable tools for mortality conversation. Through sharing stories, Jason helps people discover they have more choice and control over their final chapters than they ever imagined they had. This is a great conversation with filmmakers Barry and Jason. They share how they became acquainted with Allyson, who was a hospice nurse, and the very limited number of days, only 12, that they spent with her, they chose not to name themselves as the directors of the documentary because they really felt like that she was the director. Allyson had a very strong personality, pretty opinionated, and her friends said she was a little on the bossy side. Barry believes that one of the lessons to be learned from the documentary is that we have more agency and decision-making power at the end of life than we really think we do. Allyson's story is proof of that, and you'll see that in the film. They intentionally considered the documentary as an organic recording of Allyson's end-of-life experience rather than as reality viewing. If you're interested in watching the film or screening it at your organization, you can find information on the Hospice Foundation of America website. And remember, the name of the film is From Caregiver to Patient, Hospice Nurse Allyson's Final 39 Days. So you can go to hospicefoundation.org and check it out. There's a lot to learn. Jason and Barry, welcome to the Heart of Hospice podcast. I'm so glad to have you guys with me.
We're thrilled to be here.
Yeah, thank you so much.
It's going to be a great conversation. I'm excited by this because we're going to be talking about a documentary that focuses all on a hospice nurse. And so being a hospice nurse, I'm excited to hear Allyson's voice and her story come out in our conversation today. But to get us started, I'm going to try something absolutely new. I have not told anybody this, didn't tell you guys ahead of time. I usually do an icebreaker question, but we're not going to do that today. I want to do something different. This is my first recording day of the year for 2026. And I want you guys to join me in something that I became obsessed with several years ago. I have been making a gratitude list every day for 10 years. My family, my friends, anybody that I actually randomly encountered when I first started doing this, it became a little bit odd. And I will say, I am sorry to the lady who happened to be sitting next to me on the plane that time. And I asked her to make a gratitude list with me. But I want you guys to do a gratitude list. Only 2 items from each of you, just could be big or small. Tell me something you're grateful for today. Jason, why don't you go first?
Oh, thank you so much, Ellen. Let's see, my gratitude list. I am grateful.
Do you need a hint, Jason? A prompt?
The definition of gratitude, G-R-A. I feel like it's a spelling bee at this point.
Yeah, you're having a little test anxiety? That's terrible. That was not my intention.
I am grateful for the opportunity to continue working with this film. When we created the film, I didn't know what was going to happen. I thought maybe, when we'll get into this later, I thought maybe it would fall flat. I thought maybe no one would want to see it. Death is a hard topic to get around or even talk about at all. So the ability to be on this podcast, I'm grateful to you, Helen, and the Heart of Hospice podcast for having us on and allowing us to continue telling Allyson's story. The second thing I'm grateful for, I am grateful for my friends who answer the phone while I'm walking my dogs. I don't really have much to say. I don't really know why I'm calling them. I'm just bored while I'm walking my dogs, and it keeps me in touch with my friends. So I'm thankful for them as well.
Oh, good. Okay, Barry, your turn.
I've had some time to prepare, so thank you for taking so much time, Jason. I'm grateful for the love and health of my family and my friends. And on the professional side, I'm grateful that things are happening so magically and serendipitously, and that we were connected with Allyson and that we're able to continue to bring Allyson's message to more and more people, which is exactly her dying wish and what she wanted to.
Perfect. Okay, I'll throw my 2 in. Mine are simple today, or at least my first one is, I'm grateful that the coffee shop had the tea that I like when I went in this morning, very early because it's very cold here today. And I'm grateful to my daughter for FaceTiming with the babies so that I get to see my grandkids almost every day. So perfect. Okay, I want to touch into your gratitude here, your connection with Allyson, this amazing documentary where she invited you in She wanted you there because she wanted you to tell her story. How did you guys even get connected with Allyson? Jason, you want to take this one, or Barry?
I'll take this one. There's more backstory which we'll cover, but there is a hospice nurse in Atlanta who we have done projects with in the past and who we know for many, many years, named Lenice Shortle. On a Wednesday about a year and a half ago, Lenice called up and said, my best friend Allyson, who is also a hospice nurse, was just diagnosed with glioblastoma brain cancer. It's a very bad diagnosis. She has a tumor the size of a tangerine in her head. And I told her about the work that you guys do, and we had been doing virtual memorials and produced the world's first death-positive Instagram reality series. So we had been creating media content. She said, she wants to meet you to diagnose her end-of-life journey. So we said, okay. We met with her on a Friday. This is 2 days later. We spent about 3 hours together, talking, laughing, drinking coffee. It was everything from tears to just belly laughs. And we decided that we were very compatible to work together on this project. Mind you, not knowing exactly what this project was at this point in time. On Monday, we started filming interviews with Allyson and her husband, Shell, who shows up very prominently in the movie, in the documentary. On Wednesday, Allyson and her family hosted a living funeral, or what her friends called the Allyson is Not Yet Dead party, for 150 people at her house with a band. And we'll talk more about this, but we filmed about 20 interviews at that party with friends and family. On Saturday, she took a friend up on a standing invitation for 20 years to visit their lake house, which she did. On Monday, Allyson went into hospice. On Tuesday, we filmed with her one last time, and it was the last day she ever spoke. She died about 2 weeks later. We then filmed her green burial and a memorial service at the hospice where she worked. So Allyson died 39 days after diagnosis from glioblastoma, and Jason and I only knew her for 12 days and developed a remarkably intimate relationship in those 12 days.
She was very, very open about the diagnosis and giving you access and talking with her friends and her husband. Really amazing to watch this unfold. It was very advanced by the time you guys started discussing things with her.
Yes, I mean, she was, yeah, and even when we had met her initially on that Friday, I had worked previously in dementia care. She had, she was having trouble keeping some thoughts together, and it was it wasn't a perfectly linear conversation. But you could tell that when she was talking about her passion for helping people with end of life or with hospice or talking about death, there was no confusion at that point, right? Because she was in her groove at that point, and she would tell us, this is what I want you to do. And we sort of went from there. We left on Friday. I didn't really know what was going to happen. We said, we have experience doing memorial videos. I can do a memorial video. She did not want just a memorial video from us. She said, you're gonna make this. You're gonna make a movie, and it's gonna help other people. And at the time, I said yes, but I don't know if I really believed it, And then Barry's like, "Oh, I found a camera crew." He calls me on Saturday. "I found a camera crew. They've done this documentary. You should take a." So I go and I look at the documentary. He's like, "Well, it's actually it was well shot." And I was like, "Okay, well, I guess we're doing this. Oh, we're gonna go. We need to see her on Monday," because we knew that time was of an essence. That there was not much time. I mean, that urgency was the underlying stress of the conversation, right? And then and you said she was really open, and she when people showed up at her funeral, she said hello. They would come say hello, and she would say, "Great, now go over there and talk to those guys."
Oh,
right?
to
She
you
immediately
guys.
directed them. Yeah, she
Right.
was like an associate producer. She was also in the film. We don't even name ourselves as director of the film, because we really think she directed it. She really told us what to do, and in very clear terms, which hopefully the audience gets the chance to see it. This will come across very clearly through the film.
Yeah, and it sounds to me, just from watching the film, that that's exactly in alignment with Allison's personality. And her friends even talked about it at the funeral, that she was large and in charge. She liked being in control, maybe a little bit bossy. They joked about it. Yeah, so I can definitely see how she wanted to orchestrate all of that happening at the party. So, and I love the way the film starts. That's the opening part of it, is the party. Not with her diagnosis and a conversation about how gravely ill she is, but people arriving in her home and the food and the drinks and greeting her. What were you going to say, Barry?
I was going to say, one of the dominant themes that we think emerges from this film is the notion of that we have more choice and control and agency in end-of-life situations than we may think. And you talked about, Allison's personality, which was quite strong. She brought her friends and family along with her. Like when we would first, and this is in the film, but when we would talk to people about their reaction to the Green funeral or to the Allyson is not yet dead party, they were like, well, when I first heard about this, I wasn't so sure. But I mean, Allison's force of personality was like, this is what I want. This is what we're doing. Get on board.
Right. And in the conversations that you had with Allyson, where her friend is seated next to her, and when her husband is seated next to her, Allyson was very intentional that she felt this was a gift to her, knowing she had little time, although she seemed at that point to have lost track of what she had been told. They were having to remind her, because she said, I only have a few weeks, and they said, yes, that's what we were told. And she didn't remember that. But she said it was a great gift to know that there's a very tangible, finite endpoint. She seemed to see it as a blessing.
It was really remarkable that the default response that I would have would be the sadness and isolate. I would be sad and I would be like, oh, I don't want to do anything or see anyone. I'm going to die. Why does it matter? Right. I would just,
right.
You would go into negative thoughts. She not only didn't have that for herself, but she would then explain to all of her friends and family. Explain is probably a very delicate way to put it. She would tell them that they weren't allowed to have her. This was not about them being sad. This was about us being able to celebrate while we can, and that we were going to face this death, together and wide-eyed and directly towards it, which was really remarkable.
There was a moment when she was sitting with her husband where she said, no tears, this isn't sad. And of course, I was a little bit struck by that because, first of all, she's telling them how to grieve. And it doesn't work that way. And her friend pushes back, who's also, I think, a hospice nurse. She pushes back and said, for us, this is sad. You're leaving, and for us, that's a sad thing. And Allyson doesn't really bite on that. She doesn't have any kind of acceptance of that, or she doesn't want to include that in her experience. Barry, did you get that kind of vibe from her, that she was really just going to keep that part of things out of her experience?
Yes, her denial of other people's grief is sort of very prevalent throughout the film. Now, neither Jason or I, and you know this already, and you can tell by listening to us, we're not trained professionals. We don't have letters behind our name. So we've been careful not to make inferences or judgments about that.
Right.
So was that her personality? Was that her grieving style? Was that the pathology and the disease progression? We don't know. But clearly, she asks people and tells people, don't be sad, don't grieve. This is happy, this is good. We have experienced different reactions to that among audiences. Some people look at that as a sign of strength and fearlessness, which Allyson definitely was fearless. And some people feel uncomfortable with that, right? As you said, telling other people how to grieve.
Yeah, I got a little bit of the discomfort part of things. I think everybody should have the opportunity to grieve however they want to. And for Allyson, one of the things that she found important or valuable to her was humor. She even said the glio made her funnier. and she and her husband joked about that a lot. And he said, basically she wasn't as funny as she thought she was. But yeah, she talked about how the humor had become part of who she was and how she was experiencing the glioblastoma. It was a little interesting, but you could tell that's how she handled it. That was one of her coping mechanisms. And in the memorial service that they had for her, the funeral, the hospice team talked about how she was funny and how they enjoyed that part of her, which I thought was very beautiful. So one of the things that I was really struck by in the film was the butterfly graphic. And I want to talk about that because I'm a really visual person, and I really love the butterfly graphic that you guys used. Jason, can you describe for listeners what the butterfly looks like?
Absolutely. And so we actually, when trying to determine what the graphic or how to visually represent the film, and it was a butterfly glioblastoma is what they called it. So if it was I'm not a doctor, but I believe if it's in the middle of your head and it goes into a bunch of different areas of your brain, it kind of looks like a butterfly. An absolutely horrifying butterfly. However, so we said, okay, we had the image of is that an MRI, Barry? I think it's an MRI. Sometimes
it's an MRI, Dr. Zamer.
Yeah.
Thank you, Dr. Koch. We had that image of the butterfly, and it was like, okay, well, what if we animate that image into a butterfly? So we used all of the colors that you have from an MRI, and we had her brain and that image actually, kind of hatched. We didn't go into cocoons, Barry. I apologize. We weren't, accurate to all, bug ornithology or whatever those words are.
I thought it was a chrysalis, actually.
Sorry, chrysalis. Thank you, Barry. I knew you would come in handy there. So what we did is we actually animate her that scan turning into the butterfly, and then we have that butterfly fly off of the screen. And we used that to introduce the movie, and then we used that to introduce each of the sort of chapters throughout the documentary.
And the interesting thing about a butterfly is you did not colorize it. It's not colored. It's white or white and gray on a black background, which I don't know if you guys have thought about this, but it was almost skeletal in the way it looked. It was spectral.
Like an MRI.
Yes, which was, I guess, not ironic, but maybe a little poetic, because for Allyson, that was a death image, a deathly image for her health. Yeah, I was really struck by the graphics. So I hope listeners, when they get the chance, after they hear the podcast, will go and watch the film and be able to see this graphic, because I really think that was very impactful. I was very moved by that particular piece of it. It's very interesting.
When we first saw it, we said our response were wow, and then followed by that's a bit haunting was sort of because it kind of took you back, because it's not a moth, it's not it's a butterfly. You know that it's a butterfly, but at the same time it has none of the colors. It doesn't doesn't look like flying confetti, right? So
right.
There's none of that joy in it.
Right, it looks like a ghostly butterfly, a skeletal butterfly. Yeah, but I think it's perfect. It fits. It fits completely with the whole thing. I hope you're enjoying this episode. We're going to pause for just a minute. My guest has more to share.
When you're caring for someone who is dying, every moment matters, and it can feel overwhelming when you don't know what to expect. That's where BK Books can help. BK Books offers compassionate, easy-to-read resources for families and professionals facing the end of life. Created by nurse and hospice pioneer Barbara Carnes, these trusted guides explain the changes that happen as someone is dying and how to bring comfort, compassion, and care along the way. People don't die like they do in the movies. Understanding what's normal can ease fear and help you feel more prepared. From short booklets to helpful videos, BK Books brings clarity to the unknown, so you can focus on what matters most, being present and caring well. If you're supporting someone at the end of life, you don't have to figure it out alone. Explore the trusted resources from end-of-life educator Barbara Carnes at bkbooks.com. This episode is sponsored by Hospice Navigation Services.
If you or someone you care about is dealing with a life-limiting illness, you need a guide. Hospice Navigation Services is here to help you get the best end-of-life care possible. We understand the importance of personalized, experienced support. Hospice navigators provide one-on-one support over the phone or through video calls to guide you every step of the way. They'll answer your questions, explain what hospice care looks like, and give you the tools to feel confident in your decisions. Whether you're planning ahead or you have an urgent need, Hospice Navigation Services helps you and your family understand your options for end-of-life care. A hospice navigation session is a great way to troubleshoot your current hospice care and get answers to your questions. You don't have to go through this alone. You deserve compassionate support and guidance for your end-of-life experience. Hospice Navigation Services can be your guide. To book your hospice navigation session and receive your free guide to end-of-life care, visit our website at hospicenavigation.com. It's your journey. Hospice Navigation Services can be your guide. I want to talk about your presence in all of this. You were witness and documenting some very intimate conversations and some intimate emotions from people. Did you guys ever feel like there was a point where you were invasive, that you were treading on a sacred experience? Barry, did you ever have any vibe that maybe you had pushed in too far?
No, we really didn't. And that was a conscious choice. In the month or two before the making of this documentary that just appeared, we had been working on an idea for a TV pilot, right? And one of the decision points you have to make is it going to be a documentary or is it going to be a more exploitative reality show? And we didn't want to go in reality show. So there were a couple of moments, and there was one very particular moment where this became very crystallized in our production, right? So the family invited us in. With the exception of 2 or 3 people, everybody was very trusting and open initially. But there was one close family member, one friend, and one more distant family member who, had natural, apprehension, suspicion. What's going on here? What are these guys going to do? Are they going to do right by Allyson or not? But there was one moment where we were filming in Allyson's hospice room the last day she spoke. And one of the distant relatives, when we came in with the camera, wouldn't look at us. He got up and he walked out of the room, and he didn't come back in until we left. And at that moment, we knew we were not going to exploit or do a reality film, because if we were doing something reality TV, we would have courted conflict, right? We would have gone into the hallway with him and confronted him with a camera. So no, this was surprisingly and incredibly organic. Jason and I were speaking yesterday. We're not family. We're not friends. We were not the hired help, but we were in the most intimate circles of the family during the most intimate possible situation. And Jason, you might have another thought on this. It felt very comfortable and organic. There was not a moment where I don't think others felt, that we were exploiting Allyson.
We did have a moment where, we met her on the Friday. I also had everyone sign the release on Friday, right? And so I was the sign the release guy, which is a role that, you have to do it, otherwise you can't do the movie because someone could pull the plug on you halfway through. Right. It's like, okay, if we're gonna get a camera crew, we're gonna do these things, let's sign a release. And so we went through that process, and the best friend, the husband, Allyson, son, everyone signs right away. One family member says, okay, well, then this starts the conversation of like, well, why do you need that? And I was like, well, here's why we need it. We want to work on this, and we don't want to work on something if we think it can be taken away from us at the last second, at the last mile. She's like, but what if Shell, which is Allyson's husband, what if he doesn't like it? And I said, well, if he doesn't like it, I'm probably not going to be able to promote it in good faith or work on it, right? Barry and I are doing this because we think it's important and it's fun. And so that's, this lane of dedutainment has appeared, and we're going to try to walk down it. And so he's like, okay, well, if the husband is against it, I'm going to have a lot of trouble ever promoting the film or working with it. And I think we sort of kept with that. So we've And so that was one of the other things that had come up was around at the point you have a person sign a piece of paper, they then ask you more questions. That question came up, well, what if you do something that's not approved of by the family? And it was like, well, I'm not going to be pushing something that people think is negative. It's not the role that we want to take.
Yeah. But I can understand it's such an intimate experience. And then if you're talking with a family member, they're in the middle of the grieving process in this experience anyway. So I can imagine it would have been probably very weird for you not to have somebody that pushed back on the whole thing. Yeah, you had a remarkable group of people, because not only was her family open to it, all of her friends, or a lot of them, were hospice and end-of-life workers. So these were people who were leaning in, which was pretty amazing.
There's an interesting dynamic in the film that emerged, which is this notion of, and this is actually the name of the continuing education class that's offered by Hospice Foundation of America, From Caregiver to Patient, Hospice Nurse Allyson's Final 39 Days. And the notion of what we call it as being on the other side of the bedpan, when caregivers and care providers become patients. And there was a really interesting dynamic that you've got all these hospice workers who professionally have journeyed with hundreds or thousands of people, but now they're both professionals, but they're both friends and family and intimates. And it was interesting to see that grief dynamic among this group of professionals who are encountering their own grief.
Yeah. And what it comes down to is people who work in death care, end-of-life care, we grieve just like everybody else. The good, the bad, the dysfunctional, the denial. I mean, Allyson had her own, at least it struck me as being some denial of things. Yeah, wanting to keep it on the lighter side, the humorous side of things. Yeah, we grieve just like everybody else. But there is an expectation, I think, from people who don't work in our industry, and probably within ourselves as well, that we will grieve better somehow. What do you guys think?
I actually found it to be a relief that there wasn't some sort of superior grieving mechanism that I was unfamiliar with.
Yeah,
right?
that they would be perfect in it somehow.
I was glad they haven't, ascended to an astral plane that I don't understand, Barry. I don't think I can get tickets on that one.
I don't think so either.
Yeah, we're just human like everybody else. And, we experience that kind of screwed up grief and all the dysfunction in our own personal losses, not just the loss of a colleague. But when they got up, the first scene at the funeral service, maybe it was the hospice chaplain, had the small, it was like tiny little cymbals, yes.
And Tibetan bells.
Tibetan bells, yes. So it rings. And before she could even bang them together, it's very small, very soft ring, she had to stop for just a second because she was getting ready to cry. And here she was leading, this service, and already impacted by the emotional loss of her friend and her coworker. It just goes to show you that we're not calloused. We still grieve. End-of-life workers are just like everybody else. Maybe a little darker humor, but yeah, just the same as everybody else.
That was one of the conversations we had quite a bit when we were that first 3 hours with Allyson, where she would, and again, we weren't totally linear. So she would be starting to go through like that as a hospice nurse, you let anyone, who is dying, you try to honor the way that they want to die or what they want to do, this sort of patient-centered approach or individual-centered approach, right? So you're putting them in the forefront. And I would keep telling her, it's like, Allyson, but now it's you. You're the one now, right? Because she was used to doing it as a you, not as an I. And then I think if I think of her responses to grief through that lens, then I'm like, oh, okay, that makes sense. This is how she wants it to be.
Yeah.
She's going to be in charge of the grief that's around her until she dies, and then she theoretically is no longer in control afterwards, despite her many threats to haunt us.
Definitely.
Which she hasn't done yet, and so that's one of the guideposts. let's do things that don't get us haunted by Allyson.
So you did it right.
We know we did it right. If we get haunted, we have to make some modifications.
I love it. I love it. And with her personality, she would probably love that idea to send you a message from wherever she happens to be now. So do you think the film communicates what Allyson wanted, Barry?
I think through some level of skill and some level of dumb luck, we captured exactly what Allyson wanted to do. You know, I come from a media background. I used to work at Turner Network TV and Cartoon Network Latin America, and have created and launched a lot of TV shows and content. And very rarely have I seen anything that is resonating as strongly as this movie is with, again, death care workers and hospice workers. Somehow we captured something that I think very completely fulfills what Allyson wanted to happen and speaks directly to a lot of issues that we face when we are dying, and a lot of issues that hospice workers and death care workers face in their professional lives. Again, some level of skill and some level of capturing a little bit of lightning in a bottle.
Did Allyson ever say at any point in the process that she was second-guessing her decision to let you guys do this?
No.
Not
Never.
ever.
I mean, she did happen to look at me quite a bit and say, and she would, and for some reason this was just me and not Barry, and I'm uncertain as to why. She would just say, no bullshit, Jason, no bullshit. She just kept pointing at me and saying, basically, I interpret that, don't create a fiction around what I'm sharing with you.
Right. No theater. Yeah.
Yeah. She's
interesting that she directed that to you all the time, Jason.
It is shocking.
Yes.
I have a couple of theories about that, but we can talk offline.
Yeah, we'll talk off mic about those. Yes, definitely, and maybe after Jason gets off the call as well. So I want
he should be on the call.
He should be okay. Good. Personal growth. It's healthy, Jason. So I want to dig a little bit personally into how this experience. I know you guys, the death-ucation, and you're really. It's not as if you're inexperienced with this. But how did watching Allyson's story unfold and speaking with her friends and her family in such intimate ways, how did that change you? Barry, you want to go first?
I was hoping you could ask Jason first. Yeah, I'll go first. I would say it reinforced a number of things for me and reminded me of a few things. One is the intimacy that is involved in end-of-life and death care work, where a lot of the typical conventional niceties and platitudes that we say and do every day sort of just are stripped away. We knew Allyson for 12 days. We walked into her family situation after she was diagnosed, and it felt good and it felt right. So that was one thing, the reminder of intimacy. The other is the preciousness of life, and just, Allyson was 64 years old. I was 64 years old when we were making this documentary. It can end for any of us, not just tomorrow, but 5 minutes from now. And working in this space just reminds me to live life and appreciate life, because it can go away in a moment.
Jason, how about you? Were you changed?
Yes, I think so. I mean, I think it's the idea that she took a time that I would think of as throwaway, the time between, knowing you're going to die, with very little time, and then being able to create meaning out of that space, right? So it's the idea that you have more choice and control in your life, before and even after, a terminal diagnosis that is, rapidly approaching. That one, and the other one was that it's the concept of seeing the death professional or death professionals, whether that be a nurse or a social worker or a chaplain, going through their grief in a human way that seemed to resonate with how I would grieve, made me feel that good. It's not like there's some right way to do it. And if I don't do that right way, then I've failed in my grief, And I thought that was the other one that kind of, it made it feel, that made it feel more human, or that my human response was normal and everyone has those, was reassuring.
I love that. I absolutely love that, because there is this grief comparison game that somehow if you're not tearful, you're doing it wrong. Or if you're too tearful, you're doing it wrong. It's a horrible comparison when in actuality, you're not doing it wrong. Nobody is. Every grief style is fine, just the way it is. So I love that. So tell me about where listeners can find the film, how they can watch, and who should be watching it. Barry?
So we have a partnership with the Hospice Foundation of America, which is sort of a preeminent hospice educational organization. The film is available as a rental on their platform at hospicefoundation.org. We've also built with them a continuing education program. So for professionals who are social workers, funeral directors, nurses, can get continuing education credit for taking the class. It's 1 CE. Again, the class is called From Caregiver to Patient, Hospice Nurse Allyson's Final 39 Days. And we are also going around the country right now doing appearances at festivals, at hospitals with hospice groups. But the primary way of seeing the film is through the Hospice Foundation of America.
Awesome.
That is our the distribution channel. And to your point of who do we think should watch the film, for me, the film's role is to act as a fire starter, a conversation starter around end of life. Going in cold with Barry, you're going to die, let's talk about it. He's not going to be able to think about the let's talk about it. He's going to be stuck on the Barry, you're going to die.
Right. Yeah. How do you get past that opener?
You're going to be absolutely stuck in the, are you kidding me? I thought I was immortal. I've seen many ostriches. They seem to survive quite fine by ignoring their problems. But it's the idea that we like that the film's role is to help you start those difficult conversations, to give you a model of one woman and the choices that she made. Those choices are not yours. You can make them, but you don't have to. And it's just the idea that gives you an understanding of, this is not it's not just a linear, there's not a single linear path that takes you from now to dead, and then that's all you're going to get, and this is how it's going to be. And so I think for myself, certainly, I had not considered the choices that she made. I had not considered any of those outcomes, frankly. And just being able to watch that gives me a sense of, okay, there's more discussion around here. There's more things that are interesting. It's not I'll just let my family, it's too painful for me to think about it. I'll just let my family do whatever they think is right. Well, I don't actually believe in that approach. And so I think it's the ability to watch the film to start that next conversation. And so I think for people who are looking to have a different thought about perhaps their own end of life or the end of life of a family member, you can use this film to try to help bridge into that conversation so that, that's not just slack-jawed amazement, as Barry just demonstrated at the comment of, Barry, you're going to die. Let's talk about what you're going to do next.
Right. It's so much easier to look at somebody else's story. So if you can watch the documentary, look at her story, look at her choices, look at the grieving style of her friends and her family and her own grieving style, and then begin to suss out what's important for you. What's important for your own death? What does the grief feel like for you? I think that's where the conversation starts. But it's always a little bit easier to have that distance and looking at somebody else's story first. Yeah. Okay, so here's my last question for you guys, because I feel like Allyson is this story, right? She is the focus of the podcast that we're doing today. So if Allyson were with us on the Zoom call today and we're doing this recording, what would she say about our conversation and the film? What would she say, Barry?
She would say, you guys kicked ass and did a good job, and I'm really glad you're doing this. And then she'd list 3 or 4 or 5 things that she would like us to do differently.
She would be in charge. She would be in charge. Jason, would you add something to that?
Yeah, she would ask why we didn't make the film longer and include more, probably. Her story was, it was really hard work to get it down to 36 minutes. And so there were a bunch of other threads. Why did we not include more of her personal life? Why did we not include more of this and that? And I think she would have more to say and more to teach. And she would then challenge us to get to work on that now.
I like that. Well, that's exactly what the documentary does. She's teaching us. She's telling us. She's showing us. So there is definitely a lot to learn. I really appreciate you guys coming on the podcast, having this conversation. Wish you best of luck with the documentary. It's a great film, and I have really enjoyed. It's been very meaningful for me to get to know you and to get to know Allyson. So thanks.
Thank you so much. This was wonderful.
Absolutely.
Thanks for listening to the Heart of Hospice podcast. Check out our sponsor in the show notes, and please leave a rating and review on Apple Podcasts. We would appreciate it if you would share this episode with your friends and family and anyone who needs to know more about hospice. Connect with us on Facebook, Instagram, and LinkedIn. And remember, no matter who you are or where you are in your hospice journey, you are the heart of hospice.
This is the Whole Care Network. Helping you tell your story one podcast at a time.